Hello students, today we will start a new topic that is about parental nutrition, and in parental nutrition how we have to prepare the medication and how we have to cut the ampoule, how we have to prepare medication when the medicine which will be in the ampoule or vial. So, in this parental administration, first is the gastric tube administration. Gastric tube, which will be provided access directly to the GI system. Means when we will give the medication directly to the GI system with the help of this Ryle's tube, and we have already discussed this topic in previous class, that is Ryle's tube feeding. So we will I will not again I will not take the class of this gastric tube administration because you people have already studied about this topic. Then next is parental administration of medication. So parental administration of medication is the administration of medication by injection into body tissues. Means what do you mean by this parental administration? Parental administration means it is the administration of medication when we will inject a medicine into our body tissue. It is called as a parental administration. When medication are administered this way, it is an invasive procedure, so it is called as a इन्वेसिव प्रोसीजर. जब हम मेडिसिन को हमारे बॉडी में इंट्रोड्यूस किया जाता है, सो इट कॉल्ड एज अ इन्वेसिव प्रोसीजर. एंड इन दिस इन्वेसिव प्रोसीजर वी हैव टू ऑल्सो फॉलो सम असेप्टिक रूल्स. हमको इसमें असेप्टिक रूल्स जो है उसको क्या करने होते हैं, फॉलो करने होते हैं. सो an invasive procedure means invasive. What do you mean by this invasive? So in invasive means tending to invade health tissue, and it involve the entry into the living body. जब हम कोई लिविंग बॉडी में कोई चीज इंसर्ट करते हैं, दैट इज कॉल्ड एज अ इन्वेसिव प्रोसीजर, एज बाय इंसिशन और बाय इंसर्शन ऑफ एन इंस्ट्रूमेंट. इंसिशन करना या फिर मतलब any cut down or any inserting any medication, it is called as a invasive procedure. And in this type of procedure we have to always use a aseptic technique. We have to use a aseptic technique. Then routes of parental therapies. In parental therapies there will be many routes. So first the common routes that will be intradermal, subcutaneous, intramuscular, intravenous, and the advanced technique. So in advanced technique that will be epidural, intrathecal, intraosseous, intraperitoneal, intrapleural, or intraarterial. So in these I have already told you in previous slide, and we will discuss one by one with the procedure. So in this slide we will only see that what all routes which will be present in the parental therapies, that is intradermal, subcutaneous, intramuscular, or intravenous, and in advanced technique that is epidural, intrathecal, intraosseous, intraperitoneal, or pleural, and intra-arterial. Then this is syringe. And what are the parts of syringe? Syringe के क्या क्या part होते हैं? So in this picture you will see this is tip. So what is tip? What is the function of this tip? That is which connect with the needle. This tip which will be connected with the needle. ये needle से connect किया जाता है. Then this area that is called as a barrel. इसको हम लोग बोलते हैं barrel. So barrel, it is the outside part on which the scale are printed. Means in this barrel there will be marking is there, 1 ml, 2 ml, 3 ml, 4 ml, 5 ml. Means in this there will be marking is there. Then next is this one, this is called as a plunger. So the plunger which fits inside the barrel, ये जो है ये this plunger which will be fits inside the barrel. So in this way, these are the types, parts of the syringe. Then next is several kinds of syringe are available in different sizes. Means in market, there will be several kind of syringe are available in different size, shape and materials. Syringes range in size from, syringe का जो range है, it will be starts from 1 to 60 ml. A nurse typically uses a syringe hanging from 1 ml to 3 ml in size for injection. Means it will be depend upon the size of size for injection and the sites of injection. Means which site we will using that. Sometime we will using the subcutaneous injection. So in subcutaneous injection we will use 1 ml syringe only. Intradermal, so in this we will also use the 1 ml syringe. Then we will using for IM injection. So in IM injection we will using 3 ml, 5 ml syringes. Then in intravenous, so in intravenous we will use 10 ml. Sometimes we will also use 5 ml, 10 ml, 20 ml. So it will be depend upon the procedure, or it will be depend upon the injection or medication. Then insulin syringe are available in sizes that hold 0.3 to 1 ml. ये 0.3 to 1 ml में जो है वो available होते हैं. So this is 5 ml syringe. This one is 3 ml syringe. This is called as a tuberculin syringe, and this is a insulin syringe. Then next is the needle. So this is the part of the needle. So most needles are made of stainless steel and all are disposable. Means we will not use this needles means it is not reusable. ये reusable नहीं होता है, and it will be made up of the stainless steel. ये stainless steel से बना होता है, and it is also divided in 3 parts. हमारा जो syringe है, it is also divided in 3 parts, and the needle, it is also divided in 3 parts. So first is the hub. So this is called as a hub. So in hub, which feeds onto the tip of a syringe. ये जो hub है, ये किससे connected रहता है? It will be connected with the tip of a syringe. हमारा जो syringe है उससे ये connect होता है. Then next is the shaft. Shaft means which connected to the hub. जो किससे connected है? It will be connected to the hub. Then next is the bevel. Bevel, the tip of the needle, means it is a tip of the needle, and in this bevel the hole which will be present, so that the medication which will be entered into the syringe. With the help of this bevel only, the medication which will be enter into the syringe. So this is the part of the needle. Then this is the size of the needle. So 19 gauze, this is 19 gauze, means the size of the gauze which will be lower, but the size of the needle which will be larger. So इसमें आप देख रहे हैं it is 19 gauze. ये 19 gauze का है, लेकिन इसका size और इसकी जो thickness है वो ज़्यादा है. Then next is the 20 gauze. This one is a 20 gauze. This is 21 gauze. This is 23 gauze, and this one is a 25 gauze. So these are the size of the needle. Then the gauze varies from 18 to 30. Use longer needle for IM injection and a shorter needle for subcutaneous injection. Means we will use a longer needle for this intravascular injection, and we will use a shorter needle for subcutaneous injection. Then what all equipments we have to require for preparing the medicine. So to administer parenteral medication, nurses use syringes and needles to withdraw medication from ampoules and vials. मतलब whenever we will prepare a injection, in that time we have the nurses, they will use a syringe or needle. क्यों use करते हैं? To withdraw medication. किससे withdraw करने के लिए? It will be withdrawing the medication from ampoules and vials. So this is called as a ampoule, and this is called as a vial. Then this is a procedure that is removing medication from an ampoule. हम ampoule से कैसे हमको medication को remove करना है? It is also a procedure, so we have to remember the things which will be written in this. So the definition. So the definition of this, that is, to remove medication from an ampoule defines that you prepare medication from an ampoule for IV or IM or another administration of medication. Means when we will removing a medication from एनी एम्पुल, जब भी हम एम्पुल से कोई भी मेडिकेशन रिमूव करते हैं, and why we were removing the medication? To prepare the medication from an ampoule for IV injection or IM injection or another administration of the medication, that it is called as a removing medication from an ampoule. Then what is the purpose of this removing medication from an ampoule? That is to prepare medication for administration of medication by sterile method. Means why we have to removing the medicine from the ampoule? To prepare a medication for administration of a medication, and it should be in a sterile method. ये किसमें होना चाहिए? Sterile method में होना चाहिए. And when we will prepare a medication and when we will remove a medicine from the ampoule, so what all equipments which will be required? So first is a medication chart. पहला जो है हमारे पास क्या होना चाहिए? Medication chart, then sterile syringe, then sterile needle to remove the medicine from the ampoule. Then second needle optional, if the needle which will be damaged or any other thing which will be happen, so we have to keep the sterile syringe in optional. Then we have to keep the spirit swab, then ampoule, spirit swab to clean the area of the ampoule वाले area को clean करने के लिए. Then ampoule of medication prescribed, means the doctor which will be prescribing the medication, and the medication which will be in a available in a ampoule, so we have to capture the sample of medication. Then ampoule cutter, if available, we have to capture the ampoule cutter. Then we have to capture kidney tray to discard liquid waste, or steel tray to keeping all these equipments, then container for discard if possible, and we have to also keep the paper bag to discard a solid waste. So these all equipments which will be required in the procedure of removing medication from an ampoule. So we will start the procedure. So first we have to gather the equipments, check the medication order against the original doctor's order according to hospital or agency policy. Firstly we have to gather the equipment. पहले हमको पूरे equipment collect करना है. Then we have to check the medication order. Medication order जो doctor ने prescribe किया है according to hospital policy, we have to check. Why? This comparison helps to identify that may have occurred when orders were transcribed. मतलब हमको why we have to check, we have to compare this comparison which will be help to identify करने में ये help करता है कि कुछ changes तो नहीं हुए हैं. Then next after that we have to do the perform hand hygiene to prevent the spread of infection. Then tap the stem of ampoule or twist your wrist quickly while holding the ampoule vertically. So I will showing the picture or figure 83. In this you will be clear. So this facilitates movement of medication in the stem to the body of the ampoule. ये क्यों करते हैं हम लोग? So that the fluid which will be present in the stem, जो भी stem में present है वो कहाँ आ जाएगा? हमारे जो ampoule है उसके body में आ जाए, इसलिए हमको इसको ampoule को twist करना है. Then wipe the neck around the ampoule by spirit swab. Means if the if the neck which will be contaminated and when it will be break, so the microorganism which will be enter. So firstly we have to clean that area. Then after drying, means first we have to wait for drying the spirit के dry होने तक हमको क्या करना है? wait करना है. Put and round the ampoule cutter to the neck and of the ampoule roundly. उसके बाद हमको क्या करना है? We have to kept the ampoule cutter को round करके neck को क्या करना है? Roundly हमको ampoule cutter को apply करना है. To cut smoothly and avoid making any shattered glass fragments. मतलब इससे क्या होता है? जो हमारा ampoule है वो smoothly क्या हो सकता है? टूट जाता है, and it will avoid making any shattered or glass fragments which will be enter into the ampoule. Then next is put spirit swab to the neck of the ampoule. Use a snapping motion to break off the top of the ampoule along the pre-scored line at its neck. Always break away from your body. अब क्या करना है? First we will take a ampoule cutter and put and round the ampoule cutter to the neck of the ampoule roundly. पहले हमको round से क्या करना है? जो ampoule cutter है उससे हमको राउंडली हमको एम्पुल के नेक को पूरी तरह से क्या करना है, अप्लाई करना है. Then after that again we have to take a spirit swab and we have to hold the neck of the ampoule and we have to break the ampoule of the top of the ampoule. ampoule का जो टॉप है उससे, नेक का जो टॉप है उससे हमको धीरे से क्या करना है, ब्रेक करना है. एंड whenever we will break the ampoule we have to always break away from your body. हमारे बॉडी से ये हमेशा क्या होना चाहिए, दूर होना चाहिए. दिस प्रोटेक्ट्स द नर्सेस फेस एंड फिंगर फ्रॉम एनी shattered glass fragment. मतलब ये क्या करता है, इट विल बी प्रोटेक्ट द नर्सेस, नर्सेस के फेस. मतलब अगर हम ज्यादा बॉडी से टच करके या बॉडी के पास में रख करके अगर हम लोग इसको करेंगे तो क्या होने के चांसेस है, जो ग्लास के फ्रेगमेंट्स है वो फेस में या फिर हमारे बॉडी में लग सकते हैं. देन रिमूव द कैप फ्रॉम द नीडल बाय पुलिंग इट स्ट्रेट ऑफ. उसके बाद हमको क्या करना है, वी हैव टू रिमूव द कैप फ्रॉम द नीडल. नीडल से हमको कैप रिमूव करना है एंड वी हैव टू पुल इट स्ट्रेट ऑफ. और हमको स्ट्रेट ऑफ क्या करना है, पुल करना है. Hold the ampoule by your non-dominant hand. Usually the non-dominant hand means the left hand, means if the person is right-handed, so the left hand, which is called as a non-dominating hand. So and insert the needle into the ampoule. उसके बाद हमको we have to hold the ampoule in a non-dominant hand or left hand and we have to insert the needle into the ampoule. हमको ampoule में क्या करना है, needle को इंसर्ट करना है. देन बीइंग केयरफुल नॉट टू टच द रिम. वो जो रिम है जहां से हमने ब्रेक किया है उसको हमको टच नहीं करना है. द रिम ऑफ एम्पुल इज कंसिडर्ड कंटामिनेटेड. यूज ऑफ नीडल प्रिवेंट द एक्सीडेंटल विड्रॉइंग ऑफ स्मॉल ग्लास पार्टिकल विद द मेडिकेशन. इसमें क्या हो सकता है, व्हेन वी विल टच द रिम ऑफ एम्पुल इट इज कंसिडर्ड एज अ कंटामिनेटेड. use of a needle prevents the accidentally withdrawing of small ग्लास पार्टिकल. जो ग्लास पार्टिकल है वो मेडिकेशन के साथ अंदर जाने के चांसेस होते हैं. सो उसको हमको प्रिवेंट करना है. सो इन दिस पिक्चर यू विल सी दैट कट पॉइंट ऑन द एम्पुल. ये जो है ये दिस इज द नेक ऑफ द एम्पुल. ये एम्पुल का नेक है एंड दिस इज द बॉडी. सो फर्स्ट we have to how to drop medication from the stem, trapping the stem on a ampoule. Then next is पहले हमको क्या करना है, जो एम्पुल कटर है उससे हमको वी हैव टू अप्लाई इन ऑल एरिया ऑफ द नेक ऑफ द एम्पुल. देन आफ्टर दैट वी हैव टू होल्ड लाइक दिस, इस तरह से पकड़ के. देन वी हैव टू ट्विस्टिंग योर रिस्ट होल्डिंग इट वर्टिकली होल्ड करके. देन वी हैव टू ब्रेक डाउन द एम्पुल. उसके बाद हमको ब्रेक डाउन करना है. देन withdraw medication. So in this way we have to withdrawing the medication. So withdraw medication in the amount ordered plus a small amount more 30%. Do not inject air into solution. Insert the tip of the needle into the ampoule. So we have to insert the tip of the needle into the ampoule. Then withdraw fluid into the syringe. और उसके बाद हमको क्या करना है, with the help of plunger we have to withdraw the medication. Touch the plunger at the knob only. हमको सिर्फ प्लंगर का जो नॉब है उसको हमको टच करना है. by withdrawing a small amount more of medication any air bubbles in the syringe can be displaced once the syringe is removed. जब हम syringe को बाहर निकालेंगे then we have to remove the air. हमको air को remove करना है. we will not give the air with the medication, so it will be causing the air embolism. Then handling the plunger at the knob only will keep the shaft of the plunger sterile. मतलब we will only touch the plunger at the knob. knob का जो plunger है हमको उसी को ही टच करना है. only will keep the shaft, ताकि क्या हो, जो shaft of plunger है it should be sterile. do not expel any air bubbles that may form in the solution. Wait until the needle has been withdrawn to tap the syringe and expel the air carefully. means do not expel any air bubble that may form in the solution. मतलब solution में हमको air bubbles को remove नहीं करना है. wait until the needle has been withdrawn. जब तक कि हम needle बाहर नहीं निकाल लेते तब तक हमको wait करना है to tap the syringe. then after that we have to tap the syringe and expel the air carefully. check the amount of medication in the syringe and discard any surplus. means if in ampoule it will be written 1 ml. अगर 1 ml लिखा हुआ है. So in syringe we have to check the medication which will be 1 ml that will be present or not. So ejecting air into the solution increase pressure in the ampoule. If we will रिमूव और इजेक्ट द एयर इनटू द सॉल्यूशन, अगर हम एम्पुल में ही सॉल्यूशन को क्या करेंगे, इजेक्ट करेंगे, सो इट विल बी इंक्रीज द प्रेशर. एम्पुल में ये क्या क्रिएट करेगा, प्रेशर क्रिएट करता है एंड कैन फोर्स द मेडिकेशन टू स्पिल आउट ओवर द एम्पुल. और फोर्स से क्या हो सकता है, जो मेडिसिन है वो बाहर गिर सकता है. सो एम्पुल्स में हैव ओवरफिल एंड केयरफुल मेजरमेंट एंश्योर दैट द करेक्ट डोज इज विथड्रॉ. मतलब केयरफुली जब हम मेजर करेंगे देन ओनली वी विल बी एबल टू गिव अ केयरफुल dose which will be withdrawing or not. Then after that we have to discard the ampoule in a kidney tray. Kidney tray में हमको ampoule discard करना है और suitable container after comparing with the medication chart. फिर again we have to compare with the medication chart. जो हमारे पास में medication chart है उससे हमको compare करना है. Then we have to discard the ampoule in the kidney tray. If not all of medication has been removed from the ampoule, it must be discarded because there is no way to maintain the sterility of the contents in an unopened ampoule. Means इफ नॉट ऑल ऑफ, अगर हमने पूरा मेडिसिन रिमूव नहीं किया है, मीन्स इट विल बी डिपेंड अपॉन द प्रिस्क्रिप्शन विच विल बी रिटन बाय द डॉक्टर. इफ the 2 ml ampoule is there and the strength of that ampoule which will be 20 mg each 2 ml, मतलब 20 mg each 2 ml. So 1 ml contains 10 mg. So in that वे इट मस्ट बी डिस्कार्डेड. तो अगर हमने उसमें अगर डोज पेशेंट का लिखा है 10 mg देना है, सो वी विल रिमूव ओनली 10 mg एंड रिमेनिंग 10 mg जो है उसको हमको डिस्कार्ड कर देना है, बिकॉज वी विल नॉट मेंटेनिंग द स्टेरिलिटी ऑफ द ओपन ampoule. Then recap to the syringe by sterilized method and keep the syringe in safe and clean tray. If the medication is to be given IM or if agency policy requires the use of a needle, administer medication, attach the selected needle to the syringe. Recap the syringe by sterilized method. Means usually we will not doing the recapping and after doing the means okay. In this we have to do the recapping because we will not perform the procedure. मतलब हमने अभी IM या IV इंजेक्शन हमने कुछ दिया नहीं है, तो हम लोग क्या कर सकते हैं, we will recap the needle if the medication is to be given. अगर हमने medication दे दिया IM or if any agency policy require the use of needle to administer medication, attach the selected needle to the syringe. अगर वहाँ का हॉस्पिटल का पॉलिसी है कि हमको we will change the needle, so in that time we will change the needle, otherwise we will use that needle only. Use needle might to be touched with the inside of the ampoule, so the lumen might become dull. If you give IM, needle should be changed to new one. अगर हम IM दे रहे हैं तो needle जो है वो क्या होना चाहिए, change होना चाहिए to insert smoothly into muscles. मतलब अगर मसल्स में जो मेडिसिन है वो स्मूथली जाए, इसके लिए हमको वी हैव टू चेंज द नीडल. देन आफ्टर दैट वी हैव टू परफॉर्म द हैंड हाइजीन, then to prevent the spread of infection. हमको we have to maintain a hand hygiene, then after that we have to prevent the spread of infection. So these all about how to prepare a medicine by the ampoule.